Okay, thank you for joining this BVNA VNAM meeting. I'm Kate Davies. I'm a student vet nurse and obviously student council member of BVNA. So for Veterinary Nursing Awareness Month 2024, we're celebrating the theme of progression, and also it's the 20th year of raising awareness of veterinary nurses and what they do or what we do within regards of clinical and sometimes even non-clinical jobs. To mark the special year, other BVNA council members and myself will be delivering a series of interviews just like this one with inspiring, like you, registered nurses who have been part of the profession for 20 years or more. In the interviews, we'll be reflecting back on where the profession has been and where veterinary nursing could go in the future. And I am joined by Nikki McLeod.
Hi.
Hi, would you like to introduce yourself?
Sure. So I am Nikki McLeod. I am a registered veterinary nurse of scarily, now when I think about it, 24 years. I am a BVNA council member. I'm also a student at the University of Edinburgh studying clinical animal behaviour to a master's degree.
That's interesting. So when and how did you qualify?
So I took it the long way, and I think if nothing else, if any students are listening to this, don't panic, because I really did take a while to qualify. I started my first year at what is now not a college that exists, I don't think, actually, Edinburgh Telford College. I started in 1995 as student nurse, which is probably before half of the students have been born now. And I actually failed my first year. I really struggled, and probably still continue to struggle, which is probably why I do an awful lot of studying, just to learn and retain information. And I just really struggled to get the anatomy and the physiology side of things in my brain. I realise now why, because when I was 45, I was diagnosed with autism, and that obviously has a lot of neurodiverse intricacies with learning, and particularly with numbers. I definitely do have dyscalculia as well. So numbers I just really confused about. So when I failed my first year, I took a year out. I just was like, no, can't keep going with this. It's too difficult. Took a year out, continued to be employed as a student nurse, but didn't carry on with my training at that time, and went to a different college. The way I did my first year was like almost blocks off working and going to college, whereas what I did with my second year was go to residential, which was Barony College, which is now Scotland's Rural Agricultural College, something like that, and did my first year with them, and did my second year, and passed my first year the second time round, and did my second year first time as well. And I think the thing with the second year, I think it just all made sense, is that first year is very much, this is what the body is like for like all your anatomy and physiology, but it didn't actually make sense to me till the second year, when they started teaching you things about the things that go wrong and why you then have to know the anatomy and physiology behind it. So I qualified via the Green Book, and you'll probably hear this a lot with us vintage vet nurses, is that even before the portfolio, even before the NPL, there was a little tiny Green Book. And what you had to do is you had to do all your tasks, and you had to get a signature from the vet to say that you were competent in this task. And that went round with you the whole year training. And once that Green Book got filled and you sat your exams, at the time we called them practicals, we didn't have OSCEs, they were called practicals, and you had to go and sit your practicals, and that was you qualified with an RCVS certificate, and obviously a college diploma as well. But I actually, many years on, at around about the age sort of 46 or so, decided to go back to university. Well, actually go to university for the first time and qualify with a degree. Now, a lot of people will say, well, why would you need to bother doing that? Because I already had my registered veterinary nurse qualification. Actually, when I qualified, it wasn't even a registered veterinary nurse, it was listed veterinary nurse. But obviously then we got moved to the register later on. But I went to university for the first time in my 40s to do my top up the degree that I wanted, so I could then go on to do a master's degree in clinical animal behaviour. So I qualified from university for the very first time at the age of 50, and now I'm at Edinburgh University, hopefully getting some sort of qualification from them on clinical animal behaviour.
So you've had a bit of an adventure then,
Yeah,
when it comes to
definitely.
how did you feel being in your 40s going back to uni studying? Because I feel it's a bit of like a stigma against studying. Like, I feel it's something like we have ingrained in our brains that you do this kind of stuff when you're young, like when you're in your 20s and stuff. But like I started studying, I think, when I was 28 or 29. And even then, I was thinking, oh gosh, I'm too old, all this stuff. But part of me was glad that I'd done it now than when I was young, because it kind of like took over my life, but in a good way. But like, I would much rather been out drinking and stuff in my early 20s than staying in studying like A&P and stuff like that. So how was it for you, like going back to uni to restudy? Was you nervous or?
Well, what I forgot to say as well is when I actually became a student vet nurse, I was about that same age. So because I got married around that time. So yeah, I was about 27 as well then, because when I left school, I actually went to Kennel Maid Training College, which sounds horrendous now when you think about it, but basically it was a national certificate in animal care. There was no way at that time I was interested in veterinary nursing. So I would not have done veterinary nursing at 18. So even when I did do my veterinary nursing about 27, 28, I was a little bit older than them, but not considerably older than most of the students that were there. Going to university to do my top up, first of all, it was an online thing, so I didn't have to attend campus.
Okay.
But because I live literally 20 minutes from the campus, and I spoke to the tutors, etc. And I said to them, obviously by that time I did have my diagnosis for autism, and I did say to them that I learn better face to face. If that sounds really silly, but sometimes online learning, it's just noise. It's just, and you have to keep repeating and repeating it. And I says, is there any possible chance of even being able to attend some lectures? So I did. They let me attend some lectures. They also let me come to the university to sit exams, because again, with the disability conditions that they gave me extra time at exams. They gave me my own room. So I did have a little bit of the uni life, which was quite interesting, because I obviously didn't really get that, because sort of the residential college I was at, you only did it sort of in sort of blocks sort of thing. So going to university as a very middle-aged woman compared to the other students, it was interesting, but I didn't, the university campus that I was at was also a nursing and midwifery, as in human, campus. So you do get a lot of mature students that are around there as well. So it felt quite a mix. And certainly now that I'm at Edinburgh University, even more so. I mean, you get a huge mix of ages, that it's not really a thing. It doesn't really bother you. But the good thing was that when I was doing my top up at university, I did that over 4 years. And basically the way that Edinburgh and Napier University worked it was that your top up was year 3 and year 4 of the standard 4 years of a normal student graduate. So, and we actually had a student that was placement with us and is now employed with us at my practice. We was on that 4-year course. So we basically went to university together, and she did obviously her first, second, third and fourth year. And I did my third year in 2 years and my fourth year in 2 years. So we actually graduated together, and she is more than half of my age. but it didn't matter. It didn't, we were both like, we actually, when the results came through together, we got into a consult room and we told each other's results. And it doesn't matter how old you are, you still like get so super excited when you find out that you've passed. So it was a really good experience. So I don't think, again, anybody that's thinking about, oh, I'm too old for this, no. If I can go to university at 50, then no, just go for it. There's no concern there about age.
Yeah, I can always remember seeing a quote saying, like, you're always going to get older. So if you think saying, you know, oh, I'm too old to study this, you're always going to get older, whether you go studying or not. The only change is that whether or not you have that degree. So I kind of like live by that now, because I'm like, that's so true. Because you'd think, you know, like even when I went at like 28, 29, I was a bit like, oh, but I'm not going to qualify till I'm like 31. But then I was like, well, I'm still going to be 31, whether I study or not. So yeah, don't let age stop you.
Absolutely. Do not let age stop you. It really is only a number, it's only a figure. And at the end of the day, what I found as well, certainly doing the degree, the top up degree, there's you've got obviously all the life experiences that you've already had
Yeah.
with not only veterinary nursing before, but everything else that I've done as well. So I don't think it can be any like factor of concern by the fact that you're older than everybody else. I really would not stop anybody from doing it because of age.
Yeah, definitely. So I think you've already answered this as well. So when and how did you qualify? Was it that you went to college and worked at the
Yeah,
same time,
I've,
like an
I've
apprenticeship?
yeah.
Yeah.
The first one is block release. First year was block release. Second year was residential, and
Mhm.
then, as I say, I've done the top up, which was a sort of combination of remote and on campus through choice. I know Napier aren't doing the top up anymore. I believe Middlesex are doing it now, and they are completely online. But I was just really lucky that it's actually quite funny that at the university, it was actually one of my lecturers from Telford years ago. So I knew her already, and I said to
Mm.
her, look, is there any possible chance? And she's like, yeah, absolutely. Just come and join the cohort that are already in their
Mm.
third year and come and do these lectures. So yeah, that was quite fun.
But which way of studying did you find most helpful, or was your favorite?
I definitely find face-to-face practical stuff
Mm.
more relevant for me,
Mm.
but you need to know the information behind it. It's really,
Yeah.
really difficult to turn around and say, well, at the end of the day, just learn this and regurgitate it. But
Mm.
regurgitating it doesn't really make a difference. You have to actually know and understand it. And for me personally, to know understand something, I sometimes have to listen to it several times. I have to take the information and look back of it, but have somebody in front of me that actually
Yeah.
says, yes, you know what, this is how you do it, this is explained it. I can listen to one subject a million times by the same person and still not get it. And then somebody else comes along and shows to me or speaks to me in a different way. And then it goes, oh yeah, actually, I've got that. Yeah,
Yeah.
I understand it now.
Yeah, yeah, I'm kind of the same. I just the other day in practice, I just had a sudden epiphany of how to work out drug calculations, because I'm rubbish with maths. I'm a little bit like you. I'm currently getting going through like diagnosis of ADHD, and so like maths for me is just a jumble of words and letters, and I can't do it. But I just suddenly done it the other day, and I was like, oh, I can do it now, which is good because I got my OSCEs in like 2 months, so that's good. But I was like, oh, I can do drug calculations now.
I
So
know
yeah,
it is honestly sometimes you just need a different mindset, a different environment, a
yeah,
different person to discuss it with you. Um, and it can make a huge bit of difference.
yeah,
This is where it is quite fortunate that neurodiversity, whether it's autism, whether it's ADHD, dyscalculia, dyslexia, it's not such a stigma now as well,
mm,
which is obviously, even if I was probably diagnosed in my teens, it probably wouldn't have been as well supported as it is now. And
no,
I think
no,
everybody that has a neurodiversity, don't worry about it, because certainly from my experience through Edinburgh Napier and through the Uni of Edinburgh, they've both been so super supportive. So if you do have, if you can feel confident enough to do so, then share your neurodiversity and get the support there, and then it just makes things a little bit easier for you.
Yeah, I agree. It was always kind of like a shame, really, wasn't it, to like having like mental issues and stuff. But yeah, thankfully now there's people are more open about it. There's more help, and I can guarantee, like, if you are like an SVN or maybe an RVN, like I can guarantee, especially from my experience with college and stuff, like they are 100% willing to help you. So it's just about like speaking out and saying what you're struggling with and stuff like that. So, which actually leads on a bit to the next question. So, what progression have you seen in your years? I was going to say many years, but I won't insult
Oh
you.
no, many years.
In your many years of the VN profession in the last 20 years.
So I actually, it's been quite interesting for me, because when I was a student nurse, again, probably just my neurodiverse head, decided that when I was a student nurse, I was going to get qualified and I was going to work my way up to head nurse, because that's what you do.
Yeah.
When you're a veterinary nurse, your aim is to be a head nurse. And about 6 years after I qualified, I was there. I was head nurse of a large practice, and it wasn't for me. And I was just like, no, don't want to do this anymore. Again, I realise now why. It's because my way of thinking isn't set out for doing like leadership stuff. And people management is the main thing. So I got there and I thought, no, I've actually fallen out of love with the profession. I don't want to do this anymore. And I completely came out of the profession. So I quit nursing completely on good terms, always thinking that my veterinary nurse qualification was always there if I needed to go back to it.
Yeah.
But I decided not. My other love that I'd also been doing alongside veterinary nursing was photography, and started my own business and went full-time as a wedding photographer and portrait photographer. So I had quite a big gap. I took about 6 or 7 years out from veterinary nursing, and then it was when we had our second son, and I had a horrendous pregnancy, and he was really ill for the first year. And of course, with things like weddings, you have to book them several years in advance. And so I obviously, when I was pregnant, took that year off from doing weddings. And then obviously when he was ill, I took that year off, which then meant looking at my diary for the next year, it was quite bare because I'm not booking anything. And it just so happened that the last wedding that I did before I had Logan, our second son, was an employee of Edinburgh Vet School. I actually went into labour at her wedding, but that's another story.
Oh gosh.
And she actually said to me, obviously after the wedding and after the baby had arrived and I was presenting them with her photographs and stuff like that, she said, oh, by the way, there is a job available, just maternity leave, and it's just reception work, but it's part-time and it's local to you. Would you be interested? And that kind of took me back into the veterinary profession. And I actually really enjoyed it because there was no pressure. All the pressure had been taken off. There was no head nurse. I wasn't even nursing. I was just doing reception work. And I actually really, really enjoyed it. And basically, long story short was I ended up getting back into veterinary nursing, but because I'd been out so long, I had to do what's called a period of supervised practice of some PSP, period of supervised practice, that's what it's called. And it's basically, you don't have to resit exams, but you have to go through all the day one skills and say, right, what do you feel you're lacking in? And put together a little portfolio with your mentor at your practice, which at the time was a head nurse in a local practice, and basically work on these skills till you feel that you're confident enough. And once you're confident enough, get it signed off, and then you're back on what was now the register. So I did that after a year, went back on the register, and then went back into veterinary nursing. But again, as I say, no inkling to want to go to head nurse.
Mm.
People did ask me, oh, is that you back in then? Do you want to go back to head nurse? And I'm like, absolutely not. I've actually met since my boss of that practice that I was head nurse at a congress last year. And we left on good terms and stuff like that, but we were talking about the fact that veterinary nursing in a head nurse position for me wasn't right. And so I was quite happy to say to him, yeah, I agree with you now. At the time, I was like, feel really bad about this, but now I'm quite happy to turn around and say, no, I know my limitations. I know where my capabilities are. So then I'm quite happy to just go with what I want to do now. And what I'm noticing is that my sort of what I want to go down with the route for veterinary nursing is obviously in behaviour, but still being within the profession, is that how much, particularly dog and cat, which is my thing, how much training and body language and just behaviour in general has changed. And I think that's the big thing that people sometimes don't realise, and it's something that's my huge passion, is that I want the veterinary nursing profession, the veterinary profession as a whole, to be a bit more open to how animals are talking to us. So the cat friendly clinic by iCat Care is just like been a huge thing for me. I made my practice get it. It was sometimes a bit of a one-man band, but over the last it was about 4 years, I worked my way through it. And I was like, I am determined that we are going to make this practice a lot more cat friendlier. Our handling is going to be better. Our facilities are going to be adapted. We don't have to do huge things. We don't have to knock down walls or anything. We just have to make little changes. And when I think about like even a waiting room, when I qualified 20 odd years ago, it was one usually small waiting room and every animal was flung in together. So you'd have dogs and cats and rabbits and their caregivers all sitting beside each other. And now when I think about that, I'm horrified, because it's just like, how stressful is that for not only the animals, but the caregivers too, because you do see it sometimes when even the dog waiting room has more than 3 dogs in. If the dogs start to get a bit anxious and worked up just now, the caregivers get a bit worked up. So I just think that change that ISFM, iCat Care have made in order to make things a lot more friendly for cats has been fantastic. And now we've got dog friendly. Now we're even going down the route of rabbit friendly. And everybody's like, oh gosh, that's a bit excessive, isn't it? But at the end of the day, it's making everybody in that practice think about what can we do to make the emotional health of that animal a lot better, instead of just flinging it into a situation where it feels stressed. Even today, I had a client say to me, a caregiver say to me, oh, I'm so glad you never put my dog on the table. And I'm just like, yeah, that's a really old sort of fashioned way of thinking, that every single dog has to go on the table. And years ago, we would have done that. We would have put, regardless of how big the dog is, because the vet says so, this 30-kilo Labrador has to go onto the table to be examined. It's like mind-blowing. Why would you do that? Whereas now, pretty much everything, apart from your teeny tiny toy dogs, everything I go on the floor with. And sometimes I do get on the floor with them. I'll lie down on the floor with them. And I just think that's one huge, massive change from 20 odd years ago.
Yeah. And in the long run as well, like it benefits you as well, because if you're de-stressing an animal, it's like less likely you're going to get bit and stuff then. So yeah, I don't know about the rabbit one though, the rabbit friendly. I'll have to, because I'm very much into rabbit welfare. I love rabbits. So I'll have to Google that.
I think it is very new. I don't think it's completely it was just somebody said to me about it at a conference, a congress, because obviously we've got ISFM doing the cat friendly, that's been 10 years. Dogs Trust have been doing the dog friendly now for about 2 years. And somebody did mention to me, I think, what is it, the Rabbit Welfare Organisation? I can't remember the
Okay, yeah,
exact name. I think they're looking down now the route of rabbit friendly,
yeah,
which again is going to benefit. I'm not into rabbits. I'm seriously allergic to rabbits, so I
yeah,
can't
yeah.
touch them. Everybody in my practice knows that, and they're brilliant with that.
Mm,
But I just think at the end of the day, again, thinking about the behaviour, obviously you've got a prey animal with a
mm,
rabbit,
yeah.
you've got a prey and predator animal with a cat.
Mm.
Don't put them together, and that's what
Yeah,
happens so much. So again, that's only going to improve things, isn't it?
yeah, and like rabbits, they're animals that can just literally die from stress. So yeah, yeah, I'm going if there's any information about that, I'm gonna look into that because I like that. That's good. Yeah. So where do you see the future of veterinary nursing going or doing?
Hopefully improving for the better. And I think it
Mm,
is. I think the fact that we are now beginning to be seen by the general public as a profession on its own. I mean, when I got my stripes, and again, this is going back 20 odd years ago, you were a stripey, you had your stripey uniform as a veterinary nurse, and then you graduated or you qualified into your greens, but you were very much the vet's nurse. You weren't I never felt really that you were like a person that was a profession on its own.
mm,
And I feel now that it's hopefully slowly but surely going down the same route that the NHS, and you're going to get your advanced practitioners and you're going to have nurses that hopefully can do things without having to go down, right, I'm sorry, I can't do anything, I'm not allowed to prescribe or diagnose, you have to see the vet.
mm,
I definitely feel that certainly in behaviour, that is a major thing, that we can be that bond between the vets and the nurses. And again, years ago, you never would have got that. It would have been the vet's word, would have been gospel, end of story. Whereas now nurses definitely have a voice.
mm.
So we can advocate for those animals. I mean, I'm quite regularly advocate in a very loud voice sometimes with both my peers and clients. For example, if I caught a client today just about to tip a cat out of its basket, don't do that in front of me,
Yeah,
because I will
yeah,
guarantee I will stop you, because I'm going to advocate for that animal. That animal is not going to like being tipped out of its carrier just
mm,
because we don't need to rush it. But if you feel, sometimes caregivers come in and they feel rushed that they have to get the animal out quickly so you can do your examination. And I'm just like, no, you know what? Put the basket down and let's chat about, do some history taken first of all. And if the animal wants to come out, the cat wants to come out the basket itself, great. If not, look, we can just take the top off. Oh, okay. And again, years ago, you never would have done that. You would have just let them get
mm.
on with it because that was the way things were done. So I'm hoping that that continues to improve over the next years.
Yeah. Same here. So is there anything you would change, or is there anything you regret about your training, like the way you trained, or
No, because I feel I've been quite lucky and managed to do it all pretty much. If there was any
mm,
way of training as a veterinary nurse, I've now done it. I've done block
mm,
release, I've done residential, and I've done uni degree. So I've been quite lucky in the fact that I've had a taste of it all throughout my life. So a lot of people do ask me, would you go back and start straight away from school as a veterinary nurse? And I'm
mm,
like, probably not. I was quite lucky. I mean, maybe not, to be quite honest, considering how poor wages can be sometimes. But when I
mm.
qualified as a kennel maid with my animal certificate, I earned £50 a week.
Oh wow.
So, I mean, wages weren't great, but I don't think, I mean, we don't go in it for the money, despite
Yeah,
what a lot of the general public think. It's
yeah,
not, the money doesn't go to us, and we do it because we enjoy the job and we can
mm,
educate everybody, and we can, as I say, advocate for the animals. But no, I don't think I would. I don't think I would change anything, because I feel I've managed to, in the long run, in a long way for
mm,
doing it, actually get to where I am and experience lots of different things about how to be a veterinary nurse.
mm. That's good. It's good that cause not a lot of people could say that about their training and studying and the path they took or whatever. But it's yeah, it's nice that you happy like with the way you've done it and when you've done it. And going back to like the age thing, like you could like you don't regret doing it at an older
No,
age.
no.
Like, and yeah, and I don't think I do either. Like, I'm happy that I've done it now rather than going straight from school, like the bog standard thing, going straight from school, straight to uni or whatever. Like, too much studying, and yeah, I'm glad I've done it at this age as well.
Cool.
So obviously we have the Protect the Title campaign going on. What does that mean to you?
It means a lot
Mm.
because, again, over the years, most of the time, the majority of people out there just think, oh, you're just the vet's nurse.
Mm.
And that could be anybody. And that literally could be somebody that you can take off the street
Mm.
and wants to cuddle animals every day. But I'm sorry, this is a profession in its own right. And we are advocates for animals and we are qualified and registered.
Mhm.
And I feel that if we, you know what it's like, you're in the middle of studying, it's so hard to
Yeah.
get this qualification.
Mhm.
I just think it's really insulting to people that have worked hard, like you
Yeah.
and I, to get this qualification when somebody else can come along and say that they're a nurse as well. And this is where protected title and VNAM are so important because it's pushing that out to the public that we are a profession in our own right and we should be named in our own right. We should not just be the vet's nurse, we should be a registered veterinary nurse and be proud of it. And the only way to get that is to be qualified. It doesn't matter how you've qualified, do all the routes possible, like I've done. But if you've worked hard to get that qualification, only you should hold that title. And I am so behind BVNA and all the hard work that they're doing
Mhm.
to protect that title because it's so important and may not happen in my lifetime, but hopefully in years to come, that
Yeah.
registered veterinary nurses are only people that have been through the qualifications and have worked hard to get there.
Yeah. And I feel as well, people kind of underestimate what we do. Like we're allowed to, in like, what, obviously within certain extent, we're allowed to kind of do like minor surgeries, but yeah, people only kind, like you said, only kind of see us as cuddling animals and cleaning up the animals pee and poo where at the end of the day, so but it's like, no, we can do so much more things, and again, it doesn't have to be clinical. Like, you could go to universities and colleges to teach, and it's just so many jobs on a list for like one, um like, yeah, like title, I guess. That, yeah, like, I agree, like it should be protected, and I kind of agree with you as well. It annoys me, like, annoy yeah, annoys me, I'm gonna say it, that you have people calling themselves nurses when you're not, and you kind of like, I mean this with love. Like, you put yourself through, like, 2 years my course was. So it's like you put yourself through 2 years of just pure stress and
Mm-hmm.
exams and assignments and stuff to get to where you are, to be able to say, yeah, I'm a registered nurse. And then, like you said, some random person on Facebook then can kind of take that title away from you
Mm-hmm.
and be like, and they could have just owned dogs for like 40 years, and is like, well, I've owned dogs for 40 years, so I'm basically a nurse. And it's like, you're not, though.
And we have exactly the same struggle in the behaviour world as well. Whereas
Mm.
anybody can call themselves a dog behaviourist, an animal behaviourist, anybody can call themselves a dog trainer,
Mm.
and anybody can call themselves a veterinary nurse. And it's just like nobody can call themselves a vet unless they have been
Yeah.
through vet school.
Mm.
And I'm sorry, being a nurse, okay, we're not on the same scale as a vet, but we know a lot of information and it's all regulated and we have rules to follow. And there's stuff that we're allowed to do and there's stuff that we're not allowed to do. And in order to be a registered veterinary nurse, it, as you say, is a hell of a lot of work. And we should be rewarded for that and not
Mm.
be insulted by somebody else coming off the street and calling themselves a nurse. So
Yeah.
hashtag protect the title VN. Absolutely.
Yeah. Agreed. Well, I think we better start wrapping this up. So thank you, Nikki, and thank you for everyone who's joined us and is celebrating VNAM. I can't wait to see all the display pictures and stuff when people start sending them in. Just make sure you follow us on social media to keep updated with stuff like that, and also check the BVNA website.